Hello everyone, my name is Zelma Uribe, and today I will be discussing the treatment option of gene therapy for oral cavity cancer. It is also regarded as head and neck cancer due to the location of the cancer. Everyone take a moment and recall. Do you guys know what cancer is? Well, if you don't know, cancer is a group of disease characterized by 1. Abnormal cell growth, 2. The ability to invade adjacent tissue and distant organs, and 3. Eventual death. If you also recall from my previous presentation, the lack of gene therapy for oral cavity cancer encouraged me to broaden my investigation and research. Thus, this is called the head and neck cancer gene therapy because of the clinical trials that are experimented and researched on now. To remind you guys a bit, what is oral cavity cancer? Well, it is cancer that starts in the mouth. This can include the lips, inside lining of the cheeks, gingiva, also known as the gums, floor of the mouth, hard palate, and the front 2/3 of the tongue, also known as the anterior 2/3 of the tongue. I hope this image is familiar because I showed it to you previously, and it depicts the areas and regions of the mouth or the oral cavity for cancer. Moving on, let's take a look at the signs and symptoms of oral cavity cancer if you guys may have forgotten. In the bottom right corner, you can see a person's lip which can look like it has a cold sore on it, but in reality, it is a sore in the mouth that bleeds and does not heal. In addition, a lump or thickening in the cheek may occur, pain in the mouth that does not go away. A person may have a white or red patch as depicted on the top right picture. And even though that this may sound like a common everyday symptom, a sore throat, and finally, difficulty chewing, swallowing, or moving the tongue or jaw, which are all essential for daily living activities. It is almost impossible to achieve gene therapy without the TP53 gene. Gene therapy has the potential for targeting cancer cells while sparing normal tissues. These treatments are potentially useful for recurrent diseases. Gene therapy may be defined as the introduction of genetic material into a cell to modify cellular function. The transfer is either in vivo, in which the gene is introduced into the body, or ex vivo, in which a tumor is removed, the genetic material is delivered, and the cells are then reintroduced into the patient. The ex vivo approach has not been utilized in head and neck cancer because superficial lesions of the head and neck usually lend themselves to direct injection of genetic material. Both of these methods of gene therapy are depicted on the left picture. In order for gene therapy to occur, there is a gene that must be acted upon. This gene is the p53 gene. In 1992, Field was able to determine through research the localization of the gene. The human p53 gene is located on the 17th chromosome, which is illustrated in the bottom right picture. Genetic material is transferred via vectors that may be chemical, physical, or viral. The ideal vector could transfer an exact amount of genetic material into a specific area of each target cell, thereby allowing proper expression of the gene product without causing toxicity. Unfortunately, the ideal vector does not exist. The first strategy is to restore a defective tumor suppressor gene, also known as replacement gene therapy. The second strategy is to enhance immune surveillance, also known as immunotherapy. The third strategy is to activate pro-drugs that have a chemotherapeutic effect, also known as suicide gene therapy. And the final strategy in gene therapy is to introduce viruses that destroy tumor cells as part of the replication cycle. Also called the TP53 gene and tumor protein p53 gene, it is to transfer the desired gene into a target cell. A carrier is required. Such vehicles of gene delivery are known as vectors. There are two main classes: viral vectors and non-viral vectors. The viruses most commonly used in gene therapy include retroviruses, adenoviruses, and herpes viruses. Let's start out with retroviruses. Retroviruses contain RNA genomes that undergo reverse transcription after infecting a cell, thereby producing double-stranded DNA. This DNA integrates in a stable, random fashion into the host genome, thus passing copies of the gene to all subsequent generations of cells. One limitation of retroviruses is that they can only infect actively dividing cells, leaving quiescent cells unaffected. As DNA is permanently inserted, this also raises long-term safety questions. Adenoviruses. An adenovirus is a DNA virus that infects a cell, loses its protein code, and transfers DNA into the nucleus, where it is transcribed. This DNA does not integrate into the host genome, and thus its effects are transient. Therefore, multiple administrations of the vector are usually required. The advantage of adenoviral vectors is that most cells are susceptible to infection, regardless of their position in the cell cycle. Herpes virus. Some of you may think that sounds familiar. Well, it should. Most herpes virus vectors are developed from strains of herpes simplex virus type 1, abbreviated as HSV-1. If you don't know what that is, it is commonly known as a cold sore or a fever blister. This is a double-stranded DNA virus that has several interesting properties, including the ability to remain latent in tissue and to be reactivated at the original site of infection. After infecting a cell, HSV-1 replicates within the cell, causing cell lysis and infection of surrounding cells. As a tumor suppressor gene, a mutation may cause cancer cells to grow and spread in the body. The protein produced by this gene normally works to prevent cells from growing too much and helps destroy cells. The p53 gene functions as a tumor suppressor gene responding to cell stress and DNA damage by activating other genes, inhibiting DNA synthesis, and inducing apoptosis. The loss of p53 gene function leads to unregulated cellular proliferation. Inactivation or mutation of the p53 gene product occurs in approximately 70% of human solid tumors, including 45% to 70% in squamous cell carcinoma of the head and neck. The basis of replacement gene therapy has focused on restoration of normal p53 gene expression, which would restore the cell's control of its life cycle. A genetically engineered type 5 adenovirus, abbreviated as AD-P53, has been studied by Clayman et al. This virus is replication defective with the cytomegalovirus promoted. Human wild-type p53 cDNA placed in the deleted E1 region of the vector. In preclinical evaluations, this virus induced apoptosis in squamous cell carcinoma of the head and neck cell lines without significant effects on normal cell lines. ADP53 also prevented the establishment of tumors after subcutaneous injection of squamous cell carcinoma of the head and neck cell lines in a nude mouse model. Phase 1 trial of ADP53 had 33 patients with locally recurrent squamous cell carcinoma of the head and neck, consisted of patients with surgically unresectable disease and patients who subsequently underwent a resection. Treatment consisted of intralesional injection 3 times a week for 2 weeks in the non-surgical arm, and 1 week of treatment followed by an intraoperative and postoperative dose in the surgical arm. Injections were tolerated well, with injection site pain and fever being the most common side effects. Representative biopsy samples showed p53 transgene expression despite detectable antibodies to type 5 adenovirus in patients who received greater than 107 plaque-forming units of the virus. In the surgical arm of the study, 4 of 15 patients were alive with no evidence of disease at 11 to 29 months. 1 was alive with disease and 8 died of their disease, and 2 died of unrelated causes. An international Phase 2 study is currently evaluating ADP53 in 170 patients. This study group is also considering the use of ADP53 as an adjuvant treatment. Future studies of ADP53 may combine the virus with traditional chemotherapy. Gene-directed enzyme prodrug therapy, abbreviated as GDEP, is also called suicide gene therapy. This approach has attracted increasing attention. The basic principle behind the suicide gene therapy is the selective intratumoral activation of a non-toxic drug by specific transfer of the activating transgene into tumor cells. This approach encompasses several therapeutic systems, but HSV-TK is most extensively utilized. This gene encodes a viral enzyme that phosphorylates terminating DNA synthesis. This system selectively targets actively dividing cancer cells. Adeno-associated virus, abbreviated AAV, is mediated delivery of the HSV TK gene is illustrated in a nude mouse model. Suicide gene therapy can also use adenovirus. Exploiting a virus with a known deletion in the E1B region of its genome, the ONCS company developed and brought into clinical trial the oncolytic ONCS-015 virus. ONCS-015 is currently the most prominent and clinically evaluated CRADP53 vector, which can only proliferate effectively in p53 mutant but not p53 wild-type cells. However, this concept remains controversial. In an in vivo study, ONCS-015 was proved to inhibit tumor growth, and its anti-tumor efficacy combined with chemotherapy was significantly greater than either agent alone. Numerous trials have been conducted among patients with various advanced cancers. In a phase 2 trial, 37 patients with recurrent head and neck carcinoma were enrolled. Significant tumor regression was observed in 21% of evaluable patients, with no toxicity to injected normal peritumoral tissues. The most notable adenoviral therapy is the ONCS-015 viral therapy. Adenovirus ONCS-015 has been engineered to lack the viral E1B protein. In the absence of E1B protein, the virus is unable to replicate in healthy cells with a normal p53 pathway. Due to mutations, cancer cells often have a deficiency in p53 pathways, and thus allows ONCS-015 to replicate and lyse the cell. ONCS-015 has been tested in phase 1 and 2 trials on squamous cell carcinoma of head and neck that resulted in tumor regression, which correlate to the p53 status of the tumor. Phase 2 trials of ONCS-015 in combination with chemotherapy has demonstrated even better response and have led to a phase 3 study. In the image, A is showing a normal cell with p53. Everything goes as normal and cell cycle goes normally. In B, the mutant p53 pathway is present. Gene therapy offers an innovative approach to the treatment of cancer. As our understanding of the molecular mechanisms of cancer expands, it is becoming possible to exploit these principles and to selectively target tumors. Squamous cell carcinoma of the head and neck is an attractive tumor target due to its frequent genetic mutations and propensity for local and regional recurrence. Phase 1 trials have established the safety of genetic therapy in squamous cell carcinoma of the head and neck, and Phase 2 studies have demonstrated clinical efficacy. Phase 3 clinical trials and studies of the use of gene therapy are needed. Importantly, gene therapy has the potential for reducing the tumor burden and improving quality of life in patients with squamous cell carcinoma of the head and neck, More importantly, oral cavity cancer. Although it may not be deadly or fatal, it is a cosmetic burden to some. Gene therapy is primarily limited by the need to directly inject the vector into a lesion. This makes head and neck cancer a particularly appropriate target because most primarily and recurrent lesions are accessible by needle. Intravenous methods of administration have been attempted in animal models. However, significant efficacy has not been demonstrated. Normal cells have the ability to regulate their cell cycles and eventually undergo programmed cell death, also known as apoptosis. Cancer cells have lost the ability to regulate their cell cycles, largely due to mutations and overexpression of cell cycle regulators. Several genetic mutations have been described in head and neck cancer. The most extensively studied mutations are those of p53 gene mutations. Without such gene mutations, gene therapy would not be possible on oral cavity cancer or head and neck cancer. These are my references. Thank you for your time and have a great day.